Hello students, as we know, cells divide to grow and repair tissues. Now, cell division is a highly controlled process and cancer is a disease of rapid, abnormal, uncontrolled multiplication of cells. So, cancer arises due to excessive, uncontrolled division of cells. Now, in today's video, we are going to study pharmacology of alkylating agents. Now, alkylating agents is a class of anti-cancer drugs. Now, these alkylating agents are cell cycle phase non-specific drug that do not act specifically on one phase of the cell cycle. On the contrary, they can act on any of the phases of cell cycle, including the G0 phase, that is the resting phase of the cell. Now, alkylating agents are so named because their chemical structure consists of reactive alkyl groups like methyl group, butyl group, etc. And these alkylating agents, they possess the ability to add these alkyl groups to the biological molecules like DNA and proteins. And the process is called as alkylation. Now, this alkylation of DNA and proteins make them non-functional, and this either stops the cell growth or causes the cell death. Now, let's understand mechanism of action of alkylating agents with an example. Now, this is an alkylating agent. It is mechlorothiamine. Now, under physiological conditions in aqueous solution, mechlorothiamine forms positively charged electrophilic, that is electron deficient alkyl groups. Now, being positively charged, it can very quickly react with negatively charged nucleophilic electron-rich groups present on DNA or proteins. Now, most preferred nucleobase for alkylation is the guanine. So, this is the guanine nucleobase which is found in the DNA structure. Now, here nitrogen on the 7th position is the nucleophilic center. Now, this N7 nitrogen is rich in electrons and it is attacked by the electrophile. So, this positively charged alkylating agent, it attacks N7, that is the nucleophilic center of the guanine base. And this guanine base is a part of it is a building block of the DNA. So, this is how mechlorothiamine alkylates the guanine nucleobase in the DNA structure. So, this is the alkylated guanine. Now, this alkylation of guanine stops DNA replication and it further stops cell division. Now, here it is important to understand that alkyl groups are added at nucleophilic centers, that is atoms that are electron rich like nitrogen, then oxygen, phosphorus or sulfur atoms. Now, besides guanine, other nucleobases that can be alkylated are adenine, cytosine and thymine. Now, alkylating agents can alkylate proteins and DNA, thus making them non-functional. Now, alkylating agents rapidly attack bases which are present on the DNA, and this causes damage to the DNA. Now, as we all know, DNA is made up of nucleotides. Nucleotides are the building blocks of DNA. And each nucleotide is made up of deoxyribose sugar, a phosphate group, and it consists of a base. So, now let's understand how alkylating agents react with DNA. Now, alkylating agents react with DNA in two ways. Now, they react and alkylate nucleobases either on one single DNA strand, or they can alkylate nucleobases of both the DNA strands. Now, let's first understand that how do they alkylate nucleobases on one DNA strand. So look at this figure. These are the two strands of DNA. Now as you can see here, these are the bases. A for adenine, G stands for guanine, C stands for cytosine, and T stands for thymine. Now as you can see here, this procarbazine represented as P. Now the procarbazine reacts with guanine nucleobase that is present on one DNA strand. So this shows how some alkylating agents react with bases only on a single DNA strand. Now in addition to this, few alkylating agents can react with nucleobases on both the DNA strands, and this results in the formation of cross linkages between the two strands. So as you can see here, carmustine represented as C. Now carmustine reacts and alkylate guanine nucleobase present on one DNA strand and cytosine nucleobase present on the other DNA strand. So this produces cross linkages between the two strands, and alkylation of DNA prevents DNA replication. It prevents synthesis of RNA, that is transcription, and further it also prevents synthesis of proteins. So this either stops the cell growth or it results in the cell death. So this is how alkylating agents, they prevent excessive multiplication or proliferation of cancerous cells. Now, after discussing mechanism of action of alkylating agents, let's study indications and toxicities of each class of alkylating agents. Now, alkylating agents are classified in different classes, like for example, nitrogen mustard. Now, other classes are ethylene imine, then alkyl sulfonates, nitrosoureas, triazine, methyl hydrazine. So the first category or the first class of alkylating agents we are going to study here is the nitrogen mustard. Now drugs that belong to this class are mechlorethamine, then cyclophosphamide, then ifosfamide, chlorambucil, and malphyllin. Now mechlorethamine is the first nitrogen mustard drug that is given only by intravenous route. Now, its main indications are Hodgkin and non-Hodgkin lymphoma, and its toxicities include nausea, vomiting, and myelosuppression, that is bone marrow suppression. Now, another nitrogen mustard drug is the cyclophosphamide. Now, another drug, ifosfamide, it is a congener or it is a derivative of cyclophosphamide. It has a longer half-life compared to cyclophosphamide. Now, cyclophosphamide is inactive as such, but it is biotransformed in the liver to produce active metabolites, namely aldophosphamide and phosphoramide mustard. In addition to this, it also produces another toxic metabolite, that is the acrolein. Now, cyclophosphamide is highly efficacious in treating solid tumors like breast cancer, ovarian cancer, small cell lung cancer, and it is also effective in the treatment of leukemias and lymphomas. Now, cyclophosphamide causes bladder toxicity, and this includes hemorrhagic cystitis and bladder carcinoma. Now, hemorrhagic cystitis is the inflammatory condition of the urinary bladder that can cause bleeding from the urinary bladder. So this bladder toxicity and another toxicity, that is the alopecia, are the specific toxic effects of cyclophosphamide, and these are produced because of the toxic metabolite, that is the acrolein. Now, in addition to this, cyclophosphamide is highly amitogenic. It causes excessive vomiting, and it also produces myelosuppression, that is bone marrow suppression. Now, ifosfamide is useful in treating bronchogenic, breast, testicular, then bladder, head and neck carcinomas, osteogenic sarcoma, and some lymphomas. Now, as ifosfamide is a derivative of cyclophosphamide, its toxicity is similar to that of cyclophosphamide. However, it causes less alopecia and is less amitogenic. Now, very important to understand here is this, that Mesna is a medication that is administered before the administration of cyclophosphamide or ifosfamide. Now, Mesna prevents hemorrhagic cystitis. Mesna decreases the risk of bleeding from urinary bladder. Now, what the Mesna does is this, that it binds to the toxic metabolites. Like, for example, it binds to the toxic metabolite of cyclophosphamide, that is acrolein, and thereby it prevents the hemorrhagic cystitis. So, Mesna binds and inactivate the vesicotoxic metabolite of cyclophosphamide, that is acrolein. It also binds to the toxic metabolite of ifosfamide. Now, another nitrogen mustard drug is the chlorambucil. Now, it is specially active on the lymphoid tissues, and therefore it is a drug of choice for long-term maintenance therapy of chronic lymphatic leukemia. It is also effective in non-Hodgkin lymphoma and few solid tumors. Now, specific toxic effect of chlorambucil is pulmonary fibrosis and also infertility. Besides this, it also causes myelosuppression, oral ulceration, nausea and vomiting. Now, next drug is the melphalan. It's very effective in multiple myeloma and also used in ovarian cancer. Now, myelosuppression is the major toxicity. Infections, diarrhea and pancreatitis can also occur. So, these are the drugs of nitrogen mustard class of the alkylating agents. Now, after nitrogen mustard, another class of alkylating agents is the ethylenimine. Now, the drug is the thiotepa. Now, thiotepa is effective in ovarian and bladder cancer, but because of its very high toxicity, it is seldom used now. Now, next class of alkylating agents is the alkyl sulfonates. The drug in this class is the busulfan. Now, it's highly specific for myeloid elements, that is for the elements of bone marrow, and therefore it is a drug of choice for chronic myeloid leukemia. Now, specific toxic effects of busulfan is pulmonary fibrosis, and besides this, it also causes skin pigmentation, sterility and severe myelosuppression. Now, next class of alkylating agents is the nitrosourea. Now, drugs included in this class are carmustine, lomustine and streptozotocin. Now, carmustine and lomustine, these two drugs, they cross the blood-brain barrier, and therefore these are very effective in the treatment of brain tumors. Brain tumors like glioma, then glioblastoma, then multiforme astrocytoma, medulloblastoma, and in addition to this, these are also useful in the treatment of multiple myeloma and Hodgkin's lymphoma. Now, these drugs produce nausea and vomiting. Now, specific toxicity of these two drugs is the neurotoxicity that can cause convulsions, ataxia and dizziness. Then these drugs can also cause myelosuppression, pulmonary toxicity, then visceral fibrosis and renal damage. So, this is about carmustine and lomustine. Then another nitrosourea is the streptozotocin. Now, streptozotocin is effective in the treatment of pancreatic cancer, that is a cancer of islet of Langerhans. Now, streptozotocin also causes nausea and vomiting, and the specific toxicity of streptozotocin is its nephrotoxicity, that is a toxic effect on the kidneys. Now, another alkylating agents class is the triazine, and the drugs included in this class are dacarbazine and temozolomide. Now, dacarbazine is activated in the liver, and it is effective in the treatment of malignant melanoma and Hodgkin's disease. Whereas temozolomide is very effective in brain tumors like glioma, then astrocytoma, and it is also effectively used in the treatment of melanoma. Now, toxic effect of these drugs are nausea and vomiting, then flu-like symptoms, and neuropathy, and myelosuppression. Now, another class of alkylating agents is the methylhydrazine. The drug in this class is the procarbazine. Now, procarbazine is activated in the liver and it is used in the treatment of Hodgkin and related lymphomas. In addition to this, it is also used as an alternative drug for the treatment of brain tumors. Now, toxic effects include myelosuppression. Now, here leukopenia and thrombocytopenia are the prominent toxicities. It can also cause pulmonary fibrosis. Now, here it is important to understand that procarbazine causes chromosomal damage and therefore it can produce mutations. And these mutations can result in secondary leukemias with procarbazine. Now, alcohol causes disulfiram-like reaction in patients taking procarbazine. Now, in addition to this, procarbazine is also a weak monoamine oxidase inhibitor. So, by inhibiting this enzyme, it causes hypertensive reactions when it is used concurrently with sympathomimetics and tricyclic antidepressants, and therefore it also causes the tyramine crisis. Now, procarbazine can also cause gonadal damage and sterility. So, these are the main anti-cancer drug classes that are included under the alkylating agents. Now, like alkylating agents, another category of anti-cancer drugs are the platinum coordination complexes. Now, these drugs that are included under this category, that is the platinum coordination complexes, they also cause cross-linking of the DNA. So, let's discuss here two drugs of this category, namely cisplatin and carboplatin. Now, both these drugs are administered by slow IV infusion. Now, let's first understand mechanism of action of cisplatin. Now, cisplatin is hydrolyzed intracellularly, and upon hydroxylation, it produces highly reactive moieties. And these highly reactive moieties, they react with the nitrogen on the 7th position of the guanine. Guanine, as we know, is a base that is present in the DNA, that is present in the structure of the DNA. So it causes cross linkages. It forms cross linkages with the guanine base which is present on the DNA. It also reacts with the sulfhydryl groups of cytoplasmic as well as nuclear proteins, making them non-functional, and it has a long half-life of 72 hours. Now, it is very effective in the treatment of metastatic testicular and ovarian carcinoma, and it is widely used in the treatment of solid tumors like lungs, bladder, esophageal, gastric, hepatic, and head and neck carcinoma. Now, cisplatin is a highly emetic drug and it induces excessive vomiting. Another major toxicity is the dose-dependent renal impairment. It also causes a dose-dependent renal impairment, and therefore it is highly nephrotoxic. It also causes neurotoxicity that can be manifested as tinnitus, that is a ringing sensation in the ear. It can cause deafness, and therefore it is highly ototoxic. And besides this, it can also produce sensory neuropathy. And hyperuricemia and myelosuppression are the other toxic effects of cisplatin. Then our next drug is the carboplatin. Now, this is another less reactive second generation platinum coordination compound, and its mechanism of action is similar to that of cisplatin, and it is indicated in ovarian carcinoma of epithelial origin, then squamous carcinoma of head and neck, then small cell lung cancer, breast cancer, and also useful in seminoma, that is the testicular cancer. Now, the nephrotoxicity, then ototoxicity and neurotoxicity are less with the carboplatin compared to cisplatin. Cisplatin also produces mild nausea and vomiting. Now, the dose limiting toxicity of carboplatin is the thrombocytopenia and sometimes leukopenia. It can also produce liver dysfunction. So, it is a better tolerated drug compared to cisplatin, as it is less toxic than cisplatin. So this is all about the pharmacology of alkylating agents. Please note that the information provided in this video is only for informative academic purpose. If you wish to use any of these drugs, or if you want to treat a cancer patient, then you must consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.